Good afternoon, ladies and gentlemen. This is Woody Collins, and I'm with Congo Helping Hands. And thank you for tuning in to another episode of Talking About the Congo. Today we have a couple of interesting topics. I hope that nobody says that this was uh, clickbait, but we're going to be talking about sex, jobs for sex, or sex for jobs, whichever one came first, whichever. And then we're going to also talk about a wonderful conference that we had this morning, just finished up about an hour ago, on what the Presbyterian Health Mission looks like and how it was started in the Congo. So those are the things that we're going to talk about today. I'm outside today again. Seems to be a little cooler, but than yesterday. However, the wind is not as blowing, so we don't have the clouds blowing around as much as they were yesterday. So let's go ahead and get started. Yes, the UN is investigating what happened back in 2017, 2018, up until 2000 this year, 2020, June of this year, when they had the 10th Ebola outbreak. That was over in the east of the country. The eastern area is an area that is really um, with a lot of violence, and that was one of the reasons why it took so long to shut down that Ebola outbreak. Also, it's very, it borders a couple of different countries, and people come across different areas and things. So what happened is, and what they has confirmed, they have taken statements from 51 women, and the 51 women say that they went in for jobs, seeking jobs with the UN, when well, not specifically the UN, but um, agencies like World Vision, the IRC, these big NGOs who had been given money to fight the Ebola outbreak over there. And so when the people come in, the organizations, when they get there, they do not bring everybody that that's required to operate an office. Meaning to say you won't bring in people who that's going to sweep the areas. You don't bring in people who going to rake the yards. Uh, you may you would maybe hire drivers, your cleaning people, but your doctors and your clerical people, the majority of those are brought in. But they do hire some of the local doctors and local nurses who know the language and who know the area. So to help them go to areas where the Ebola outbreak is going on. But probably most of these women, I'm sure that they was that got hired, that was seeking employment. They were of lower stature people, or it may even be in some local doctors who wanted to get hired, local nurses that wanted to get hired, and they did not. They said that the interviewee or the people in the office uh, solicited sex and sex acts from them to in order to be employed at that office. And so that what went on for a while, and so they've documented 51 cases so far to date. And I'm gonna try to get my hands on a copy of the report to see what they're doing. But right now, they've turned that over to some of the agencies who were accused in this thing, in this investigation, after the investigation, to see who did it and who it was and so forth, and try to bring these people to justice. So we will see more of this, but it is the latest and thing that's going on, that's happening. But you can understand that it probably would happen if you got people being coming into an area, and you have these poor women coming in trying to look for a job to, and they look at it as an opportunity that they can get a job to make probably a lot more than they could make doing whatever they were doing, even if they were employed, but they were solicited sex uh, of in order to get a job. So that's the story over there. And so if you Google the internet on the sex workers, sex for jobs in the Eastern Congo with Ebola, it pops up. My feed has every day has popped up with numerous articles about it. The other subject I want to talk about today is uh, I'm a Presbyterian, and the Presbyterians have been in the Congo along with other uh, Protestant denominations since the late 1890s. And so in our session today, we have a Congo Mission Network meeting, annual meeting, and this year is being held virtually. And they put together a nice program, and this program was on healthcare. And also next Saturday, there'll be another program on healthcare. So it is worthwhile if you want to get a flavor for what uh, Protestant denominations have done in the Congo. You can see it because they started out in our case, they started out in 1906 and brought it all the way up to 2020 with some of the early doctors that was there, building of hospitals, running of schools and training to train the local Congolese, and then eventually turning it over to the Congolese in 1960 at independence, and also coming back to support them with materials and things. Like for instance, Congo Helping Hands, we've taken, we shipped supplies, ultrasound machine, we provided different items of equipment, and gave them money uh, to buy supplies that they needed uh, in the, to these Presbyterian hospitals, former Presbyterian hospitals. For instance, I got a box of sutures that needs to go over there, and as soon as the COVID pandemic is over, I'm going to be taking sutures over because they need those sutures in order to do surgeries, and they're probably at this point in time not doing some elective surgeries because they don't have the sutures, and we just don't have a way to get them over there. And I've been trying to work with them to try to see if we can get some locally because the cost to ship them over there is really prohibitive, and it probably is a better deal if they can get sutures over in the country. But also we have a couple. We're going to have a couple of portable ultrasound machines, and so that is what is going on. Is that the U.S. Donors and churches still support these um, early hospitals and clinics that were established back in from 1906 to 1960. Uh, so that was the first part of the program, was the history of it, and it was very informative. And like I say, it was me has been working in the in Congo for over 20 years. It filled in a couple of gaps to me. So even I learned something. So and I also, you know, reinforced some things that I already knew. Then there was the second part of it was most interesting, and it would be really interesting for uh, the Americans from our perspective, because what Dr. Larry Schlessley did is compare the U.S. Uh, and the Congo, compared their operations, COVID-19 operations, and compare it to one another, like how we shut down um, our economy and shut down different things, where the Congolese on the 10th of March, they shut down everything. They closed off places. Even they had a quarantine where you could not go into different areas. You could not even visit those areas. It was shut down because that was the hotspot of where all the infections were occurring, and so they did not allow people to go into that part of town because it was highly susceptible. So it compares that. That is a comparison to what we did, where some states did not, uh, put down a lockdown, and different. We had it here in Indiana. We had it county by county and so forth. But it was very interesting to see some of the difference, and I think you would, if you take a look at it, you can see some things that why we, the United States, has the highest number of infections and also the highest number of deaths. And that's not only in number, but that's also per capita. Meaning to say, just because we got 300 million, yeah, we probably would have a numerical number exceeding that. But based on another country that has 100 million, uh, we still have more than 3 times that country or something like that. And then the final part of that, the program today, was they had 3 survivors of COVID-19, and each one of them gave their different stories. First was a pastor from the Midwest, how she didn't tell how she contacted, but what she went through and survived, and losing her taste for food and being things like that. But they also had a Congolese worker who also survived it, and how uh, what he did, and not only how he achieved all that without taking any medicine and things like that. So that was very interesting, and I think a lot of we don't get a lot of that on the television now. Of the survivors, we probably concentrate more on all the deaths that we're having, but there is much more survivors. As a matter of fact, in Africa and also Europe, in those places, they actually count the number of recoveries or survivors that had it and survived it. So there's a much more emphasis on survival than it is on deaths. Not to lessen the impact of someone dying a death, but it is also just to show you that number one is that you probably could survive it with the proper care, and going in early, and and surviving through it. So the Congolese worker, he was able to survive it, and told his story of and he did not infect his family. And the last person was another pastor from Knoxville, and he contracted it. And it was a story of that we often hear, that a lot of people may be familiar with, is he started having some of the symptoms on Friday, and he could not get tested until that Monday or Tuesday, and then it came up negative, and then the following Friday he was feeling bad again, and he had to come down with it. So those were the stories. I think we would enjoy it, and I'll put the link in there. So we're asking you to take a look at it, and I think you would really like it. But I would like to say to end this, thank you for stopping in today. And as always, be safe, take care of yourself and your family, and be blessed. We will talk with you later.